This podcast is for educational and informational purposes only. It should not be used to substitute the advice from your medical professional or primary care provider. If you are having any kind of medical issue or emergency, you should call 911 or go to your nearest emergency room, urgent care center, or consult with your doctor.
Welcome to Healthcare Snitches. Welcome to episode 3. I'm Kim, and I've been a registered nurse for the last 10 years.
And I'm Jasmine, and I've been in healthcare administration for over 10 years.
And today's topic is
health equity. So talking about health equity, racial discrimination in healthcare. It is Black History Month, so we did want to take the time to kind of focus on the history of racism in healthcare. Very angering, but also some ways that you can help combat this in your everyday lives. So whether that's being in a facility or just going to the doctor.
So even though you said history, it's unfortunate that it's not so far behind us.
No.
Yeah.
No.
Excuse me.
Yeah. So unfortunately, the history of racism in healthcare definitely goes way, way back, 1700s, 1800s, to eugenics.
What is eugenics?
It's the study of our races, pretty much, and the classification of our races, and basically making a superior race and then an inferior race. Of course, African Americans or Black people, indigenous people were placed at the bottom of that totem pole, with the superior race being the white race.
Which I feel they still kind of are.
They
think they are.
Yes, we think they are. And so just keep that in mind, that is kind of the foundation of everything that healthcare was built on, everything that the way that doctors practice medicine, the way that they think about the patients that they see, and the way that tests were formed, right? So when you even think about something like kidney function, that test is known to be inherently a little bit racist.
Because if you look at it, it will say like GFR, and then it will say if you are an African American male, an African American woman, a white,
yeah. So when you think about the history of racism, right? We usually think about we couldn't, slavery, and we couldn't vote, and we couldn't do all of these things that everyone else can do.
We were picking cotton.
Right. But I think a lot of people, until they encounter it, they don't necessarily think about healthcare and how race kind of plays out throughout, and how deeply rooted, like, implicit bias is in healthcare. It's actually something that really, really angers me. I know it angers you too. But it impacts Black people in several different areas that cost us our lives. So we wanted to focus on those areas really, and just kind of like talk about how we feel that it's not all in your head. Things that you can do while you're at the doctor's office, which people have mixed reviews on.
Yeah, but before we go there, do you want to give them some of the history that you researched? She actually educated me on a few things.
Yeah. So one of the things that I did my master's thesis on maternal mortality amongst African American women, and that uncovered a lot of different statistics for me in terms of it not really mattering whether you were rich or poor or You had a lot of education or very little education. As African American women, our outcomes are really bad when it comes to our complications during childbirth, our complications actually pre birth, and then our complications post, right? So we have a lot more death from simply giving birth, and it all kind of leads back to the implicit bias that is built or baked into everything really in America, but really baked into healthcare.
Question for you: when you were doing that whole research, did you come across anything that showed that Black women actually had pre-eclampsia and the doctors were not recognizing the symptoms, like really bad headaches, or even calling them in so that their urine could be tested for like protein in the urine? Bad headaches. Did any of that come across?
Some, but that wasn't the main source of us having worse outcomes. It was really that we're just not listened to. We're pretty much ignored. And so this led me to actually looking into, all right, so we understand like when schools were desegregated and all these other institutions were desegregated when the law was laid down in 1964 with the Civil Rights Act, but nobody really talks about what happened with hospitals. So that actually was part of desegregation in 1964, but really like accelerated in 1965 when Medicare and Medicaid, when that bill was passed, right? And so it tied a financial kind of carrot to the urgency of them having to desegregate. So basically it was saying like, hey, hospital over in the South, if you don't desegregate now, like you're not going to get the funding. You don't
get these coins.
Right. You're not going to get these coins to do your job, right? And so they fast tracked that, and it was actually one of the fastest institutions to be desegregated. Now that just means that they physically did that. That doesn't mean that the implicit biases and the mental
and the
part
culture
took place.
Yeah,
right.
Yeah.
So
it still hasn't taken place.
It still hasn't. So imagine what had to have happened during that time, right? So now you have white doctors seeing black patients being seen by white doctors. You have black doctors who, yes, there were very few at that time, but now you have black doctors who have to see white patients, and maybe the white patients don't want that. And so all of these different things are coming into play. Obviously, the thoughts that folks have didn't necessarily go anywhere because they came from their education.
Yep.
They came from the deeply rooted biases that are just, as I said, baked into medicine, like literally embedded into the ideals and the fundamentals of medicine. Dating back to when Black people were experimented on, right? The father of obstetrics and gynecology literally used Black women as guinea pigs without
no
anesthesia.
No anesthesia.
Without anesthesia to perform procedures such as C-sections, hysterectomies, all types of things.
I can't imagine that.
I could not imagine.
I can't imagine.
Anesthesia. And this is how he was able to come up with all of his theories or prove his theories were right or wrong, right?
Even animals get sedated.
Right. Because back then, we were not classified as being human. They didn't feel that our pain was real. They didn't feel that we even felt pain. As a matter of fact, as close as 2016, they did a survey on a bunch of med students, and it was found that the majority of them, about 80% of those medical students, felt that Black people had a higher pain tolerance so we could withstand pain at a higher level than other races, right? So that's important to note. Somehow we can withstand pain better than any other race. And then um,
this is why when people are impatient, somebody who is white over here can have an order for, let's say, morphine or for Dilaudid, for gastric issue, for like gas pains.
Right.
Somebody next door can be black and they only have Tylenol or Motrin or Toradol for the same exact problems. Yeah. And this is why.
Yep. They also believe that we have thicker skin for some reason. And this all kind of goes back to the eugenics, right? And how we were built to withstand so much because we went through slavery. We're just not human. We're not human. And this is pervasive throughout, even with children. So there's also a study that showed that children that were in the emergency room with appendicitis were given pain medication at a lower rate than their white counterparts. So,
and it even said that they weren't offered opioids, right?
Yeah, they were not even offered opioids.
So it takes us back to the Tylenol and to the Motrin.
Yeah.
Whereas something like appendicitis, that's very painful and it comes with rebound pain lots of the time. Yeah. And you need some type of opioid.
Yeah. So our pain is ignored, even though it is valid, and there's a lot of work to be done around that. But I think that's one of the biggest points where we're ignored is pain.
Oh, definitely. Yeah. Pain, and also behind that, I would say symptoms. Because I know a couple of people, I'm not going to call their names because they're probably watching this, but they've gone to doctors for like seizures, and the doctor has narrowed it down to you are stressed and you need to see a psychiatrist. This is why you are seizing. My neighbor, a doctor brushed her off, and she's Asian. She'll probably never watch this though.
I can't.
But he brushed her off as having anxiety, and this is why she is having stomach issues. Mm-hmm. Like I just feel like there are certain races where our symptoms are not taken seriously at all.
No. I know this episode is about race, but being a woman as well, our symptoms are often brushed off and classified as anxiety for some reason.
Always. We need like a Xanax.
Yeah, that'll fix everything. Mm-hmm. But yeah, they discount our pain, and it's not right. This also happens a lot to sickle cell patients that I particularly know of, and I've just working in healthcare and hospital administration. I've been part of a lot of like value-based care programs, and recently working at a hospital, we would review patient cases at times. And so one of the things we look at are people called frequent flyers who come to the ER a lot. There was one instance where we had a patient who would come to the ER several times a week, and they had sickle cell, and they were, of course, in a lot of pain, right? Because just imagine your blood trying to go through your veins, but they're misshapen.
Yeah.
And that is painful. And it's really hard to quantify your pain, especially in a disease that primarily affects African Americans. And also, if they're already looking at us like, you're so tough, you can make it through anything, and you don't really have pain and your skin is thick, then when we come there, we explain, I've seen people in a sickle cell crisis. It's not necessarily always the same, right? Mm-hmm. So the pain doesn't look the same all the time. But it's painful, and it's not always them like screaming and excruciating pain. It's very painful. I don't know what it feels like because I've just never experienced it, but I can only imagine that it is very painful just by thinking of the whole concept.
But everybody's pain tolerance is not the same also.
Yeah.
So I think that's something that they don't understand. I think that a lot of those doctors judge us as one. She's black. It doesn't hurt.
Right. Or this person has sickle cell and they're not acting like this other patient that I know that has sickle cell. So
it's different for everybody.
Yeah. So those patients are often labeled as drug seekers, unfortunately.
Yeah.
Because the only type of pain medication that usually works for them are the narcotics.
And they're very temporary.
They're very temporary. They wear off very quickly.
4 to 6 hours.
Yeah. And some of them are prescribed the medications so that they can treat themselves at home, but I haven't really seen that. I don't know if you've seen that to be the case.
For sickle cell specifically?
Yeah.
No, I've only ever seen morphine be prescribed for like cancer patients.
Okay.
That's it. I've never witnessed it.
Oh, and speaking of that, we are also less likely to receive pain medication post surgeries like hysterectomies, double mastectomies, things like that. We're less likely to receive opioids or pain medication for that, which is, I get it. I kind of get it nowadays. You're trying to combat the opioid crisis, but
we shouldn't suffer.
We shouldn't be the ones to suffer for that. Like,
and not everybody is gonna become addicted.
Yeah, we should be able to get the pain management that we need, and it's not happening.
There should be quality across the board, and it should be a protocol for every patient who has this type of surgery.
Right.
No matter what shade you are.
Right. And unfortunately, it's not. And so that's why, having health equity is so important, because it's not fair to say that Martha deserves to get, opioids after her hysterectomy, and Shaquana does not, because she does. Okay, the pain is real. We don't feel pain any less. So, I think a lot of work needs to be done on educating providers so that they don't answer surveys like they did in 2016. So in medical school, teaching them that that's not true. I know I had asked you this week, when you're studying for your nursing exam, are there any questions related to race and just something that would kind of hint that someone could have a little bit of bias, right? I think some people don't realize that they have the bias because it's so baked in.
It's like inherited.
Yeah. Because it's so baked into our culture and into everything, they don't even know that they have it. And so I don't know if, like, asking those questions, what they do after that, if they notice that you're a little bit racist. But
I don't know, Jasmine. I just feel like the ignorance stems from way back, as you stated. And this takes us back to advocating for yourself, right? Because if you are, let's say, in a sickle cell crisis, and they are telling you, oh, Tylenol, Motrin, you have sickle cell. You know what works for you. If it doesn't work, you need to be adamant. You need to ask for nurse managers. You should ask for anybody who's higher than that. You should ask for patient relations, because I just don't think that we should suffer.
No. All right. So we know they don't manage our pain well, and that is for any condition. So whether that's post-op or just going to the ER, they just don't believe us for some reason.
We're strong. We can take it.
As if, we can just take anything. I think on our end, we also have some mistrust, which rightfully so. Okay? Because historically speaking, from them experimenting on us when we really had no say in that situation, to the Tuskegee experiment where they did not provide the treatment for those Tuskegee airmen after they knew that they had syphilis. They did not provide the treatment, which had devastating effects. So
This is so heartbreaking.
yeah, countless events of them utilizing us to
Guinea pigs.
yeah, to test things out, just to see, because we're not human to them.
This is so horrible, though.
Yeah.
It's very angering. It's very sad. And what's so crazy is some clinicians still feel like this.
Yeah.
And that's the scary part too.
That is scary. There was a story recently of this. I think he was an emergency room doctor. I don't know. Somebody could correct me, but he made a TikTok and he's like, he was very annoyed. He's like, I need someone to explain to me why all of my black patients or African American, I don't know which one he used, why all of my African American patients are always on FaceTime when I go into the room to see them. And he just had like a big problem with it. And so many people responded to his video.
Why would he put that on TikTok? Like,
Because
did you think, sir? Did you really think that was a good idea?
I think he did think that it was a good idea with his very sheltered and limited thinking and knowledge.
Did his organization get involved?
I don't know. I didn't follow it that deeply, but he posted that and everyone came for him, because everyone else, these are doctors, these are just patients, people understood why the black patients would be on the phone or on FaceTime. So that's actually one of our tips for you guys, is that it's really hard to combat something like this because of people like him that don't necessarily understand why we do the things that we do. And we do them because we've been experimented on and we don't trust the healthcare system.
How many times have you known of me being on FaceTime with one of my family members when the doctor comes in?
Many times.
Since last year, at least 25, 30 times.
Yeah. If you can't be there in person, that's the next best thing, right? And with COVID and everything, they don't allow too many people in there. So
we even hopped on the turnpike a few weeks ago, right? Because we were on FaceTime and the nurse wasn't nursing, the doctor wasn't doctoring.
Yeah.
Me and my husband jumped on the turnpike and went to a Brooklyn hospital where the conditions were horrible because I needed to be face to face with these people.
Right.
So, come on. Was he serious?
Yes.
Maybe he was on opioids.
Maybe he was. And so people really, that's one of the ways you can advocate for yourself. Even if the person that is on FaceTime isn't like a medical professional or anything, it's still a form of support and a witness to what you're going through, so that they can't say, I didn't say that or I didn't do that. No, I have a witness, because although I have worked in healthcare for a long time, I'm still a black woman. I have experienced discrimination when being seen, being talked to in a certain way, being handled in a certain way. I have
even
witnessed
physically?
it. Yeah, just the way, some nurses just like the way they just grab your arms and take your blood, and just not in a nice way, not like a human, right? And so nobody wants to go to the ER or anywhere else and feel like they're being manhandled or they're not being treated fairly, or they see you treating the white patient better, and then you come around to them and you haven't been asked any questions, you haven't been given any medicine, you're not getting any fluid, you're just not getting the care that you need. Right, and then it leaves you with poor outcomes, possibly death.
You've been through it though, with these doctors.
Oh yeah.
You've been through it, and that's horrible. I'm sorry.
Yeah. Oh, thank you. So one of the things I think that people think will help this, and I think it would definitely help, but it's definitely not the cure to it, is having more people of color, so black people, any other person of color, as a doctor. And I would say that I don't necessarily agree with that.
Not at all.
Yes, having a black doctor can help you, but it's not the end all be all of making sure that you get fair health care. or the care that you are supposed to get.
We just spoke about this.
Yeah. Because, I mean, the fact of the matter is, we're all human, and sometimes the biases are not racial. They're more either socioeconomic or something else.
Yeah. So Jasmine and I actually just spoke about this before we started recording. And to me, I actually don't have any black doctors. I only have one who you recommended, and she's actually a nurse practitioner. She does dermatology stuff. I think for that, I'm going to roll with a black person because they tend to understand our skin more. Mm-hmm. They understand that if we have scalp conditions, we can't wash our hair 5 times a week because it takes us 16 hours to right. wash it, dry it, straighten it, curl it. So I need somebody who understands me on that level. But that's just dermatology. Right. I don't feel like I need an African American doctor in order to receive good care. I believe all of my doctors that I have researched give me amazing care.
Yeah, I think it may be more about comfort? The doctor themselves and how competent and thorough they are as a doctor. Because our PCP, I would say, and I was actually quite scared to even go to this PCP because of my experiences with
your trauma.
A black doctor that I had who treated me probably like maybe his daughter or something. I don't know.
Are you going to share with them what he
nope,
said? Or
I'm not going to share that.
Okay.
But I'm just going to say that
he was horrible.
He was horrible, and it wasn't because he was black. It just, him being black didn't help me any.
Right. And look at how nurturing our PCP is and how caring he is. But he also had his clinicals in the hood.
Oh, he did?
Yeah. Mm-hmm.
Oh.
He's had his clinicals in the hood. His dad was a doctor at Montefiore. Okay. And Montefiore is in the Bronx. You can go either way with that. You got your Medicaid patients and you got your commercial insurance. Okay. So I just feel like he comes from a different place.
And he's not white either.
No, he's some type of Spanish.
Yeah. So, I mean.
So he's one of us.
Yeah. Like, he's one of us. But for him, he's going to make sure, like, as a doctor, and this just goes for any type of person. So whether you're skinny or fat or you want to lose weight or you want to do whatever, he's going to give you the same kind of advice.
He is.
He's going to tell you if you're not being active, like you need to be more active.
He told me.
Yeah, so he doesn't care. And so
he told me.
That's the good thing.
You need to exercise.
Right. These are the kind of doctors that you want to have in your corner because they're going to care about your well-being.
Yep.
And give and advise you to the best of their knowledge.
Most definitely.
But if you happen to find a black doctor that does that well, I think that also helps because they understand what it's like to be us. I think another area where finding a black doctor is helpful is in the mental health space.
Oh yeah, definitely.
For me, I really don't know how, if I'm coming to you in a therapy session, explaining to you how someone at my job asking me about my hair makes me feel, as a white woman, how you would understand that coming from me. Because one thing to know about me is that my hair is going to change. Okay? And I'm going to need you not to ask every single time it changes. Just roll with the changes. Okay? Don't ask me, what did you do here? Don't ask me about
really it. with the voice?
Yes, with the voice.
With the voice?
With the voice. But I'm just saying because I just don't think a therapist, like a white woman therapist, is necessarily going to be able to relate to that. If I come to a session and I tell her how that makes me feel and how I just want to come to work and do my job and not be asked about,
not be judged.
Right, not be judged, not be asked about my hair. but a black woman therapist is going to know because she's felt the feeling. She's felt the feeling of being nervous of going in with a new hairstyle, and
or
she
going in
understands.
natural.
Right.
Is that considered professional? Like washing and going, or having dreads in corporate America? Like, they don't have to go through this.
They don't have to go through any of that. And then how you speak at work and how you show up, and if maybe you're not having a good day, then are you the angry black woman? I don't think a white woman therapist is going to understand that aspect. And so
she's not.
I actually have a white woman therapist right now, but that's due to insurance issues.
Yeah, because the other one was blackity black.
She was. Would I tell her about the microaggressions that I encounter on a daily basis? Probably I'll tell her about it. Will she be able to give me any insight into how I can deal with that?
Well, she seems to be pretty good. So there's a possibility that she might be able to give you insight. Maybe not on the black level, but just as tools to deal with it. Just because she sounds like she's really good.
Yeah.
So she could probably give you the tools, but she may not be able to relate.
Yeah.
Unless she got some red hair that's nappy as hell and she grew up being...
No.
Oh, okay.
And I also... Not that I ever did show up in my bonnet to my previous session.
Oh my God, did you?
No, I never did. I don't... That's the thing. That's a whole thing in my household where my mom was like, don't ever leave the house in a thing. Yeah.
Okay.
She was so against it. So to this day, I don't do that, but I know that if I, wanted to, I could with my black therapist.
Yeah.
I'd feel comfortable doing that, but I absolutely would not do that with another.
She would clutch her pearls.
She would clutch her pearls and say, because again, I'm coming with this hair, with faux locks, with box braids. Now I'm coming with a bonnet.
It's too much for her.
Am I even the same person? Because we're a whole different person apparently. So,
has your hair ever been touched by?
Yes, actually at SMG, one of my bosses, I had done a blowout. I don't remember how I was wearing my hair prior to that, but I did a blowout of my hair, and it was like.
Was she like, "Oh, Diane"?
Yeah, she was like, "Oh my gosh, this is so cool," and she like.
Were you like this?
I was like, oh, and then I moved, and she's like, oh, can I touch it? And I was like, sure, why not? And she's like, oh my gosh, it feels so soft. I'm like, well, what did you expect it to feel like? So
naps,
right? I mean, do you see this silky blowout? Like, girl. So yeah, for mental health, I think it's just better if you have a practitioner that can commiserate with you and feel your pain and give you good insight. Not as helpful with another type of practitioner.
Especially if you are like going to a therapist because you're having issues at work. Let's say that you work in corporate America and you have all of the credentials and all of the experience, but you just don't get the recognition, you don't get promoted. And you have people around you who know nothing, who make way more than you and do absolutely so much less than you. And then you want to speak to a therapist who may be able to relate. I mean, it's a strong possibility that she's been through some stuff too.
Yeah. It helps solidify that it's not all in your head. And I think a lot of this, we're made to feel like our pain, whether it be physical pain or mental pain, is all in our head, that we've made it up. And, you have those people you come across where they're like, I don't see color. Well, I take issue with that statement because if you're not seeing color, you're not seeing me for who I am. Because guess what? I can't choose to show up not black one day.
Right.
I walk around, I'm black. You walk around, you're black. We cannot take our skin off. So you're telling me you don't see me as a person. Not saying that you don't treat me, or you do treat me differently because of my skin color, but you saying that you don't see it, first of all, that's false. You see it. And you see it.
I think some people use that statement wrong. Like they trying to make it translate to they're not racist. Like everybody is the same to me. But I definitely see where you're coming from. It just doesn't sound good.
And what I think they need to understand is that everybody cannot be the same to you. Because we are put at the bottom of the totem pole, we actually need to be looked out for a lot more. You have to,
because we're not going to be all
right, because we're not. You have to overcompensate for us. I'm sorry. You're going to have to. Like, these healthcare professionals are going to have to start overcompensating for the fact that this healthcare system was never created with us in mind at all, because we were not human. And so you telling me you don't see color, that scares me. That makes me feel like, okay, you're not going to do all you can do to make sure that I don't slip through the cracks of this system, to make sure that I don't die from a simple complaint that I'm telling you. And as I said before, it doesn't matter how much money you have, right? Serena Williams,
oh yeah,
after she gave birth, she almost died from a blood clot because they weren't listening to her.
Yep.
Why do you think they weren't listening to her? Yes, this happens to women in other races because, like I said, they don't listen to women. But when you're a black woman, they really don't listen to you.
And money does not matter.
And money doesn't matter. Once you get on that floor, although you should be treated the same across the board, it doesn't happen. You think, oh, they're fine. They'll be okay. They have tough skin. Literally have tough skin. You don't need to take this seriously. They're not moving with urgency at all when I need you to move with urgency. If I say something hurts, you're not paying to do the test.
I have a question.
Somebody else is paying for it. Save my life.
During your last hospitalization, right? You said that there were a lot of travel nurses because they were on strike.
Yes,
and you said that they were power to the people nurses,
yes,
right?
They were black.
Did you feel more safe? Did you feel more heard? Did you feel like you received great care?
Girl, why you gonna ask me this? No, I don't.
That's why I'm asking you that.
I feel like I received mediocre care, and I don't know whether that's because they were travel nurses and they kind of don't really.
They just come to get them
right.
coins.
They're very transient, so they don't. They're kind of just like, let me just. Are you okay? This is my shift. Oh, time is up. Gotta go. More so like that. Did I feel like she tried? Yes. I can't really say that.
So
I felt
the reason
different.
why I asked you that during this podcast is to our point that sometimes being the same color doesn't necessarily mean better treatment.
It doesn't.
Yeah.
I will say though, that same nurse that was there when I was admitted and moved down to her floor, when I was discharged, she did hook me up with a bunch of like, not any drugs or anything, but just because you can't do that.
Supplies.
She hooked me up with a bunch of supplies because I was like, oh, can I have this and that? And she like went out of her way to find me a pill crusher because I needed it.
So she helped you the best
way
that
did,
she
but
could.
I don't know whether she did that because she's black or did she do that because if you all don't know, Kim is Oprah and I am Gail, okay? So she is Miss 21 Questions. She's going to interview you. She's going to talk to the stranger in the supermarket. She's going to bring an old lady home for dinner. She's going to do all of those things.
I am.
I don't do it as much.
But you're right behind me.
But I am right behind her in terms of talking to people and them feeling very comfortable opening up to me and just like, I'll kiki with people.
Yes.
And so, this is anybody. And so I don't know whether she got all that stuff from me because she saw me and I was in suffrage at one point. And I also, I'm like, I work with her too. So I don't know whether she did that or whether she felt like we got to stick together, which sometimes you do come across that and it's refreshing and it is helpful.
I've actually been that person before.
I'm sure you have. I wish you were my nurse at one point.
Stop. But I definitely have been that person. I remember I had a patient from South Plainfield and she didn't get the best treatment and her husband didn't have money and he was hungry and he stayed overnight. I went in the fridge, guys, and I got out of my lunch bag an applesauce and a fruit cup. I found out later that he was diabetic and I probably could have killed him.
Oh, so you're killing folks with
but
cups.
I shared my lunch because they didn't have money and I never have cash, so I couldn't order a tray for him.
Okay.
But yeah, I have definitely tried to look out for people.
Yeah, things like that help. I'm sure you would have done that for
Oh yeah,
a white person too.
for anybody.
Right. But I think, the more we have good people like in the workforce, the better. That don't use the color of your skin as a way to say you deserve this care or you deserve, to be ignored. Like
Right.
that is what ultimately that is what we need.
We do. Go to school, guys. Become
Yes.
clinicians and go into hospital administration. Help
There
us
has
out.
been an uptick in the number of people of color going to get their masters in public health.
Oh yes, yes, yes.
That will absolutely help because things like creating policy for healthcare, as well as being in healthcare administration and hospital administration, you don't know how many times I've been in the room or been outside of the room and overheard some things.
An ear hustle?
Right.
Hustling.
Just some things that were said. A lot of the times, upper management would use terms like uninsured or what's the other term they like to use? Not inner city, but something related to that, which is code word for Black, right? And what
was it
they
underserved?
It they throw different terms around, but they would come up with how to deal with these populations or this population in things like the throughput of the ER, who you actually decide to admit from being in the ER too. I think.
Remember the whole thing with the sandwiches and the Target gift cards?
Yes.
To try to keep people out. But with that, most of those patients were not African American.
They weren't, and that's only because of where it was.
Yeah.
But flip that somewhere else,
yeah,
they would have been African American because unfortunately racism. And so our neighborhoods have been determined by redlining, and where we're able to afford housing is not always the best neighborhood. And then where do you usually go if you get sick? You go to the hospital in your neighborhood, right? You go to that hospital, and those hospitals are usually not funded the best. They don't have the top of the line equipment to even diagnose you with some stuff you might have. And so we often end up misdiagnosed, underdiagnosed, and not treated. And what does that lead to?
Death.
Us dying.
Pearly gates.
Yeah.
On home to glory.
I know after episode 1, we did have someone that recommended potentially going to more affluent or wealthy neighborhoods to get care. We have mixed feelings about this.
We spoke about it.
We don't necessarily feel that you should go out of your way to go to the wealthiest neighborhood or the hospital in the wealthiest neighborhood to get care, because that may impact
because at the end of the day
negatively.
You're still Black.
Right.
You're still Black.
Yeah, like I said, you can't take your skin off.
Yeah.
And so you might walk up in there and I don't even know what would happen. So it's definitely not a recommendation, at least to go to the ER. But if you're having a surgery or something like that, absolutely do your research and pick the best person that does that surgery for you.
So Jasmine and I spoke about it, right? So what I was telling Jasmine is I grew up in the hood, right? I grew up in Bed-Stuy in Brooklyn. So I've never gone to the ER in my hood.
Spread love. It's the Brooklyn way.
I just have not. Because when you go to these hospitals in the hood, you become a product of your environment. So they don't care if Tyshawn over there has Medicaid and if you over here have Empire or United. They don't care. They don't care. You are going to probably be treated the same way. But like my husband has had 2 major surgeries. One was at NYU, one was at Mount Sinai. I personally like to go to reputable hospitals where I research those doctors. So I get what this person was saying when they sent that email, but I mean, we don't purposely go into different areas, but look at where our primary is and where most of our doctors are. They don't take Medicaid.
They don't.
Let me find out we went to the rich areas.
I know. Let me find out we're saying don't do it, but we are doing it. But we're not doing it
not on purpose
because they're in the wealthy areas. We're doing it because they are good doctors.
They're good doctors.
I would base my decision on that. But again, if you have to go to an ER, you don't have a choice. You do have a choice. Which, if you have the time to make the choice, maybe you don't need to go to the ER. But if you do have a choice, maybe you want to get sick in a wealthier area so that.
Are we contradicting?
We are a little bit.
Okay.
Because you're saying you wouldn't go to the ER in the hood where you live.
When we lived in Brooklyn, my husband was having a gallstone attack, right? And for men, it presents like in the chest area, not in your abdomen. So he was having chest
area
pain.
Too. I thought I was having a heart attack.
Okay, right.
I said I'm having a heart attack.
So he thought he was having a heart attack. This was in
Me
Brooklyn.
Too.
This is when we lived in Starrett City, right?
Mm-hmm.
We got in that truck. I drove all the way to NYU. To Manhattan.
Oh my God, he probably was suffering in that pain.
He was suffering.
That pain is bad.
Even he said, take me to NYU.
Okay, because he didn't want to die in the ER.
Exactly. So we went to NYU and we found out that it was gallstones.
Okay.
Was it the smartest thing? I wasn't a nurse yet. Was it the smartest thing to drive somebody like that far? No, it definitely was not. But if he had to die, he wanted to die in a good hospital.
I guess.
So I think that we contradicted.
We did.
Screw it. We go to the wealthy neighborhoods.
We do.
We too go to the wealthy neighborhoods.
Yeah. Or just depending on where you live, we live in like the New Brunswick area right now, right? So we're not going to say that's New Brunswick, New Jersey. We're not going to say, oh, we're not going to go to St. Peter's or Robert Wood Johnson. We're going to drive ourselves to.
We would go there
to Morristown or well, I'm actually not going back to either one of those hospitals.
Well, I always go to
different
Somerset
reasons.
Medical Center, which is affiliated with Robert Wood. It's just on a different campus.
Yeah. So I think those are fine. But if you're in a place where has poor care, regardless, I wouldn't go there because it's just.
Can I share what she experienced a few weeks ago in the hospital in the hood?
Yeah.
Okay. So my family member, she normally goes to North Shore, which is in Long Island, very bougie, right? With the upper crust.
Mm-hmm.
But she had to be transported to the ER. They took her to a horrible hospital in Brooklyn. Okay. I'll just tell you, it's in East New York. And she said that her roommate had on a coat and all these blankets. There was no heat. It was freezing outside because I had on a shearling, so I know it was cold. It was so cold outside. She was a fall risk, a big time fall risk. She didn't have nothing saying that she was a fall risk. She didn't have no type of bed alarms, no chair alarms. She shouldn't have been walking. She walked to the bathroom. She had to clean up herself. She was asking for 2 gowns for the whole day. They never gave her the gowns. She was MPO, which means that you are not supposed to eat because they had to give her an MRI because she could have had some bleeding going on. They gave her aspirin as a protocol for blood clots. So I asked her to put the nurse on so that I could ask for some SCD boots or for some heparin, like something. So she ended up getting Lovenox, which is good, rather than aspirin, because if she is bleeding, right, and then you take aspirin, which is a blood thinner, what's going to happen, Jasmine?
You'll bleed out.
Okay, great. So I told her not to take it, but it was just horrible. From the time that me and my husband walked into the hospital, when we walked into the hospital, the girl at the front desk was on the phone like this. So I'm looking around like, okay, so she was like this, and then I tapped on the glass and I was like, hi, do we need to stop here first? And she was like, I'll call you back. Like I was bothering her. Yes, this was at the front desk. So do you want to go to a place like this, folks? Absolutely not. You do not want to go someplace like this because then the care is poor, which it definitely was. You get on that elevator and you go upstairs, you're going to get the same treatment that you got at that front desk. I feel like our 2 hospitals here are nothing like that. Well, they could be something like that after that experience that we had.
Yeah. And the one I just had at St. Peter's, thinking it was going to be better, but
we should open up a hospital.
We should. That's the conclusion.
You know what though? There's so many African American women who are becoming nurse practitioners and who are getting their doctorates and who are like opening up urgent cares and stuff.
Yeah. I haven't met any and I haven't been to any, but I would be curious to see what that experience is like,
if the care
and
is better.
if it's better, if it's
Yeah.
different, especially for us, right? Because I just haven't had a good experience, really. Sometimes I have, but most of the time, no.
Not recently.
No.
All right. Anything else that we need to touch base on? You gave the tips.
Yeah, I think advocating for yourself is the top tip up in here. So refer back to episode 1
and 2.
Right. If you are expressing that you're in pain and you're not being listened to, don't be afraid to ask for a different doctor. If they don't respond to that, ask for patient relations if you're in the hospital. Escalate that thing all the way up to whoever it needs to be escalated to. It's hard because if you're the actual person in pain, it's really hard to advocate for
Hopefully
yourself.
They'll have family.
Right.
Or they can call 7 on your side and have them advocate for you.
Exactly.
Or help me, Howard.
Right. So advocate for yourself. Have someone that can advocate for you if you can't do that. Of course, entering into the public health space is going to be helpful. So for all of you out there that are passionate about this, getting yourself to a level where you can be in the room, where these decisions are made, where you have a chance for your voice to be heard in these rooms, where folks will feel uncomfortable making racist policies and comments just because you're in the room, even if you've never said anything. That has helped, I think.
Jasmine, you've been in the room plenty of times. I feel like no one listens.
I feel like if you say something enough, and loud enough, they'll listen. There was a slight incident at my past job. It was not really healthcare related, but it was in there addressing the murder of George Floyd.
Oh, that's what you're talking about. I thought you were talking about when you had to check a chick.
Oh, well, that was an everyday thing. But yeah, they didn't really address it like the other hospitals did, and so I spoke up about it.
She did.
And that's probably why they didn't end up liking me in the end. But after I spoke up about it, a very thorough and long email went out to the entire staff. We had a demonstration
with
outside with a moment of silence where folks were kneeling and everything. I said, oh, okay.
Power to the people.
And that was just from me saying, like, I am one of the only Black people in leadership, and I'm dissatisfied with your response to this.
Your lack of response.
Right. Your lack of response. As someone that has to continue to come here every day and make you guys millions of dollars, you could have done better.
She did, y'all. She did. She held it down.
So yeah, the more you have people like that can make their voices heard, be integral in making these decisions, and also helping people to understand things from different perspectives, I think is also helpful. Because even when we were having those conversations about the sickle cell patient, I would chime in and say, they're not drug seeking. They need pain management.
Yeah.
This is what they need outpatient. They need to see a physiatrist. They need to make sure they're keeping their regular appointments with the hematologist. Why do I have to say this? It sounds like, why do I have to say this? Because I'm not a doctor. I'm not even a nurse. But I'm just letting them know that they're not drug seeking, number one. But if you want this issue to be solved for, you need to treat them as a whole person.
Yeah, give them the resources.
And I think that's where they don't think of us as people.
And weren't we the only Black people on those calls?
Yes, we were the only Black people. And so what we're able to do is bring in that human touch to patients like that sickle cell patient to say,
so that they're aware.
Yeah. This is
They
a human.
probably really didn't understand, to be
They
honest.
didn't. They're looking at the stats. They're looking at her.
Frequent flyer,
Right. They
She's
can't
drug seeking.
understand. No, this is what the problem is. And also to that doctor on TikTok, we are going to be on FaceTime and you're going to have to deal with it because we need to look out for each other. We need to make sure because you guys aren't doing it. You're letting us die. So we need to look out for each other. We need to make sure that if something does go down, we have a witness. So those are all the reasons why we have people on FaceTime. We don't want to be alone.
Doc.
Right. And so these doctors need to be more further educated. They need to understand what it's like to live in our bodies and our experience, our everyday experience. That's not something that's going to happen overnight, but it's definitely something that is going to help, not necessarily for those listening to this podcast right now, because as patients, really just advocate for yourself, but just know that education of the provider is something that is of top of mind for a lot of medical institutions. They're looking into how they can infuse some of this health equity and implicit bias training at medical school so that while you're teaching them how to treat all these conditions, they're also learning that you may have some bias that you're unaware of.
Yeah, there should be some type of cultural awareness.
Yeah.
In all of these courses that they take.
Yep. And then ongoing to check those biases as you continue in your medical journey as a provider, right? So like every year you should have to take a cultural competency training where you're understanding, because honestly, we are not, as Black people, we are not a monolith. And also we change from year to year. So the Black person from the 60s is not the Black person right now. Some of them are still here, but we're all different. So this training needs to be like up to date, current, and they need to have it. Everyone needs to have it because quite honestly, it's not only the white doctors who mistreat us.
Oh no.
It's doctors of other races. And then again, like we said, sometimes it'd be your own people. So
yeah, all doctors should have to do it.
Yeah, all doctors should have to do it.
And it should include different backgrounds. Like Indian people may do things different than Mexican people or than Asian people. They should just, yes, this should definitely be incorporated.
It has to be part of it.
It should be part of the job.
Yeah. So speak up for yourself, educate yourself, do your research before going into appointments. Speak up while you're at your appointments, and if you're in the emergency room, don't necessarily take no for an answer. And if you're in pain, I would really, really pay attention to what you need. So if you need an opioid, they should be able to give this to you, even if it's 1 or 2 pills, to manage your pain. There's no reason why you should be in pain and suffering when the woman next door is not doing the same.
And if it's the ER, you shouldn't even have an opioid by the mouth. It should be fast acting. So
right, through your IV.
Yeah,
or intramuscular.
Yep.
So I think that is it. I mean, there's so much more we could discuss on this topic because it runs deep, but
did you state how it trickles over into the employees? Sorry, I just got here just in case you did.
No.
No,
not really, but yeah, I mean, in the beginning, I think we talked about how the staff had to pivot from being segregated to desegregation, but just know that it's still a problem for the staff.
We are living proof.
Yeah, it's still a problem, and really all we can do is make sure that we advocate for ourselves, we have the knowledge, and for those that are working in the field, that they continue to use their voice to speak up and don't allow discrimination to silence your voice.
Because it will definitely try to silence your voice.
Yeah. All right. So, just wanted to close this out by saying, happy Black History Month. It's not always the most comfortable thing to talk about, but it's definitely necessary to understand that it's not all in your head. You're not crazy. It does still happen. It's going to continue to happen. We just have to make sure we are vigilant about how we take stock in our care. And if you guys have any suggestions on any topics that you want to hear about, please be sure to email us at healthcaresnitches@gmail.com. And also check us out on social media.
Bye.
Bye, guys.
Tune in next time for more snitching.